Mr. President, on the 28th of January this year, a health service directive was issued by Queensland Health pausing the prescription of stage 1 and stage 2 hormone treatment for gender dysphoria for all new public patients under the age of 18. The pause is set to continue while an independent review into the provision of these treatments is carried out. Hormone treatments are broadly supported by Australian standards of care, clinical evidence and medical experts. They're based on evidence and expertise. Community calls for a review into these treatments do not come from experienced physicians, but rather from political activists and religious organisations. Notably, this directive exclusively impacts trans kids seeking hormone treatment for gender dysphoria. Cisgender children, however, seeking treatment for other reasons are exempt. This is direct and obvious discrimination towards trans and gender diverse people. This decision was made without consulting trans and gender diverse people or healthcare professionals. Had any consultation occurred, that government would know that indefinitely banning these treatments is expected to have severe impacts on the mental health of an already vulnerable community who experience alarmingly high rates of depression, suicide and distress caused by the feeling of incongruence between their gender identity and their sex at birth. Taking measures to ensure that practitioners are upholding best practice medical guidelines is obviously necessary, but denying an entire community access to what is in many cases life-saving medicine in the process is inexcusable. It is not in line with the current medical consensus, nor does it protect the best interests of the children that it affects. It is a clear infringement on children's right to healthcare. In November last year, the Federal Circuit and Family Court of Australia heard the case of Re-Ash No. 4, 2024, Fed-Fam C1F777, which addressed whether a 16-year-old trans boy should be able to commence testosterone treatment. In his decision, Justice Tree found the administration of testosterone was clearly appropriate, emphasising that his paramount consideration was what is in the best interests of the child. There should be no question that upholding a child's right to access treatment prescribed to them by medical professionals is in their best interests. But too often we see politicians putting their beliefs ahead of those who need this care. The ban in Queensland has been posited as a measure that will protect young trans people, but reopening the public discussion over whether it's appropriate to allow children to access hormone treatments has exactly the opposite effect. Apparently, the Queensland Government is satisfied with the evidence that puberty blockers are non-harmful when cisgender children try to access them to treat precocious puberty, but the same medication, if prescribed to trans kids, is somehow harmful. There's nothing more dangerous than removing healthcare decision-making from the patient and their doctors and into the political. An inquiry conducted last year into the Queensland Children's Gender Service found the public healthcare system was reflective of best practice guidelines and even recommended that the service be expanded. Yet, the political decision made by that government against all of the evidence was to do exactly the opposite. The loudest calls for government intervention when it comes to gender-affirming care are often coming from the same people who advocate the opposite when it comes to their freedoms. The same people who shout from the rooftops that government shouldn't interfere in communities based around religion, for example, now want to interfere in the most private decisions of others. Healthcare choices that should be exclusively between individuals and their medical professionals. I've heard many of the same people who strongly oppose gender-affirming care talk about how government should stay out of their church or their school because they're entitled to determine their own future, that their religious community should be allowed to determine its own rules in relation to matters like discrimination because of their deeply held convictions and beliefs. These advocates of small government and private decision-making seem to believe in those principles only when they align with their deeply held beliefs. A medical decision made by a child is and should be made between the patient, their parents and their doctor. There's no justification for the state to interfere, much less others who seek to impose their credence or dogma, particularly when it's antithetical to the evidence and the expertise.